Well, it's all about testing now. That's how the governor of New York, Andrew Cuomo, sees it. For him, coronavirus testing is his #1 issue, and that is why Mr. Cuomo went to Washington today to meet with the President of the United States. Here's what Governor Cuomo told Nicole Wallace on MSNBC immediately after his meeting with the President.
The meeting went well, and I think it was productive. The big issue was testing. As everybody knows, that's going to be the next step as we go forward. And how do we separate the responsibilities and the tasks on testing vis-a-vis a state and the federal government, and the acknowledgement that we all need to work together on this. It has to be a real partnership. And I think we had a very good conversation.
Governor Cuomo, maintaining diplomatic relations with Donald Trump, did not mention anything specific that the president actually agreed to. And the president didn't mention anything specific that they agreed to when the president appeared later at the White House press briefing. Governor Cuomo did say that he believes New York State has to double its current rate of testing from 20,000 tests a day to 40,000 tests a day. Dr. Zeke Emanuel will join us later in this hour to discuss a new action plan from the Rockefeller Foundation proposing what it calls, quote, an ambitious but achievable goal of rapidly expanding testing capacity to 30 million tests per week over the next 6 months. Dr. Emanuel is one of the contributors to that Rockefeller Foundation action plan. 30 million tests per week is over 4 million tests per day. A new Harvard University study says that we should be conducting at least 500,000 tests per day or more over the next 30 days. We are currently testing about 150,000 people a day nationally without any national coordination for the testing process at all. 50 states compete not just with each other, but virtually every other country in the world for testing kits and equipment necessary to do the testing. The testing crisis comes as the director of the Centers for Disease Control, Robert Redfield, gave an interview to the Washington Post in which he said a second wave of the coronavirus could be worse than what we are seeing now. He said, quote, there's a possibility that the assault of the virus on our nation next winter will actually be even more difficult than the one we just went through. And when I've said this to others, they kind of put their head back. They don't understand what I mean. We're going to have the flu epidemic and the coronavirus epidemic at the same time, he said. We'll ask Dr. Harvey Feinberg, an expert on infectious diseases, in just a moment, what he thinks about what that second wave could look like. Today, Donald Trump said, quote, we're going to do very significant testing. We're going to do very significant testing. And by we, Donald Trump does not mean Donald Trump or the Trump administration or the federal government. By we, Donald Trump means he intends to watch governors and mayors scramble to try to find ways to protect people and ways to test enough people so that governors and mayors can make careful decisions about when people can go back to work or go back to school safely. The county coroner in Albany, Georgia, told the New York Times that the coronavirus, quote, hit like a bomb. That leaves the mayor of Albany, Georgia, who will join us later in this hour, scrambling tonight to protect his community now that the Republican governor of Georgia has decided to allow the opening of some small businesses in Georgia, non-essential businesses. So beginning on Friday, if you really want a massage or a haircut or a tattoo, the governor says those businesses can all open everywhere in the state. And after you get your tattoo, you can go to the bowling alley, which is also allowed to open on Friday. Dr. Deborah Birx was asked about this at the White House briefing today. And once again, Dr. Birx gave the kind of answer that a Republican Party lawyer would give, an answer designed to protect any Republican office holder with a bad idea. Dr. Birx actually said that it's perfectly okay to open those businesses as long as you can maintain social distancing inside those businesses. Social distancing for a massage, social distancing for a tattoo, social distancing 6 feet away for hair cutting. Dr. Birx actually pretended that all of those things are possible.
if there's a way that people can social distance and do those things, then they can do those things. I don't know how, but people are very creative.
That is a purely Trumpian answer. Dr. Birx is saying someone can cut your hair from 6 feet away. Congresswoman Val Demings of Florida, whose name appears on a lot of political commentators' lists as a possible vice presidential choice for Joe Biden, will join us later in the hour to discuss the new package of relief legislation Speaker Nancy Pelosi and Senate Democratic leader Chuck Schumer have agreed to support, along with Republican leaders of Congress. The new legislation finally contains some money for testing, $25 billion to support testing. When Mitch McConnell first tried to bring the Republican version of this bill to a vote in the Senate, it did not contain 1 penny for testing, not 1 penny. The $25 billion to support testing in this country is in the legislation only because Democrats forced it to be in the legislation. And when Donald Trump signs this bill, probably later this week, he will probably once again invite no Democrats to the signing and not acknowledge any Democratic input in the legislation and claim full credit for the testing provision in the legislation. In his Washington Post interview, the director of the CDC, Dr. Redfield, said this when asked about protests against stay-at-home orders. He said, quote, "It's not helpful." Donald Trump was asked about that today.
The director of the CDC said the protests against stay-at-home orders are not helpful. You've encouraged some of these protests. What are your thoughts on the CDC director saying that these protests are not a good idea?
Well, people, look, it's not a question of helpful or not. People want to get back to work. And I've watched some of the protests, not in great detail, but I've seen that, and they're separated. There's a lot of space in between. I mean, they're watching, believe it or not, they're doing social distancing, if you can believe it.
If you can believe it. If you can believe it is one of those Donald Trump signatures that he frequently attaches to his lies. When Donald Trump says, if you can believe it, you cannot believe it. The protesters are not doing social distancing. Everyone in that room knows that the protesters are not doing social distancing. They are not carefully 6 feet apart. The protests are protests against the very concept of social distancing. If there was a serious public health official in that White House briefing today with the president, that person would have raised her voice and said something to the effect of, I have seen the pictures of those protesters and they are not social distancing and they are all risking their own lives by doing what they're doing, and they are risking the lives of other people in their communities, their neighbors and their families who they might come in contact with after being in the thick of one of those reckless and dangerous demonstrations. But everyone in that room working on the Trump team knows that being a Trump team member requires keeping their own safe distance from a truth like that. Amy Petrarch is a surgical trauma nurse at Stony Brook University Hospital on Long Island. Here is some of a video diary she has been keeping for us.
All the ICUs are still full. They're full. The sickest people are still there. Some people are getting extubated, but the truth is that there are still people on the floors who need to be intubated and come to us. So, I mean, we may have a bed or two available, but it's not like we're emptying out.
In the United States is 803,553, and as of tonight, there are 44,564 reported deaths linked to coronavirus in the United States. Leading off our discussion tonight is Dr. Harvey Feinberg, the former president of the National Academy of Medicine and the former dean of Harvard's School of Public Health. He is the chair of the National Academy's Standing Committee on Emerging Infectious Diseases. And Ron Klain is with us. He's a former senior aide to Vice President Joe Biden and President Obama. He served in the Obama administration as the chief coordinator in the fight against Ebola during the Obama administration. Dr. Feinberg, thank you very much for joining us tonight. I want to start with what the director of the CDC said about the possible second wave and how the second wave could be worse than what we've been through already because of the way it might interact with the seasonal flu. What can you tell us about that?
Lawrence, every virus is its own thing and has its own properties. So looking to the future, what will happen with this particular virus is intrinsically speculative. There are reasons to believe that we are in for the likelihood of a second wave. One of those is experience in the past with influenza pandemics, and particularly the great pandemic of 1918-19, when the second wave was much worse than the first wave. In addition to that, many of the models that project the way in which the virus and disease will behave do show this tendency to wane, that is to go down, and then at a certain point in time, as it builds up, it can rapidly escalate. So there's reason to worry about a second wave. It's prudent to plan for the likelihood of a second wave, but nobody can guarantee what will or will not happen.
Ron Klain, Joe Biden tweeted today, rather than execute a swift and aggressive effort to ramp up testing, Donald Trump is tweeting incendiary rhetoric about immigrants in the hopes that he can distract everyone from the core truth. He's moved too slowly to contain this virus, and we are all paying the price for it. Ron, Governor Cuomo went down to Washington specifically to talk to the president about testing. He was, of course, the diplomat that he has become in dealing with Donald Trump, so he didn't reveal very much about how that conversation went. Joe Biden is making testing his #1 campaign issue, and yet the president still refuses to pick up that issue and run with it, as he is uniquely empowered to do.
Yeah, Lawrence, I mean, it's kind of hard to understand at one level. The president says he wants to open up the economy. He says he wants people to go back to work. And almost every expert on the left, on the center, on the right, Republicans, Democrats, all agree that the initial condition for reopening the country is more testing, so we can separate the sick from the well, so we can monitor where the disease is flaring up, so we can know, as Dr. Feinberg said, when a second wave is coming, where it's coming. We don't test, we're not going to find it. And so testing is the essential quality. You know, as you said at the outset of the show, Lawrence, what's really stunning about this is not just that we started slow on testing. That is what it is. It's that for the past month, we've made virtually no progress at all. In the past month, there's only been one day when we've tested more than 150,000, 160,000 people in this country. Otherwise, we're basically where we've been for 4 weeks. And you can't get to a goal of 500,000 or 750,000 or 1 million tests a day if you don't make any progress at all.
Dr. Feinberg, give us your assessment of where we are on testing and where we need to go on testing.
The first thing to understand about testing, Lawrence, is that we have to understand the purpose of the testing. Do we want to identify patients who are coming down with this infection or have recently contracted it? Do we want to identify individuals who had it in the past and might be now resistant to coming down with illness? Do we want to understand in the community how widespread this virus is? We need different kinds of tests to answer those different questions, and we need all of them in much greater volume. More importantly, even than that, is that for the new serology tests that look at antibodies, we need to validate carefully whether these tests in fact perform in the way that the manufacturers claim. And right now, the FDA is allowing these tests to come to the market because of the enormous need for them. And yet we need to validate their performance or we're going to get misled potentially. So we need more tests. We need to understand the purpose. We need to deploy them where they're needed, and we need to validate their performance.
Dr. Feinberg, stay on that for a moment, because at the White House briefing today, Dr. Birx was asked about validating these tests and how the FDA is basically allowing them to rush out with tests, saying that the companies who are producing the tests have the job now of validating them themselves. And I don't think there was anything in Dr. Birx's answer that we could make sense of. She seemed to be saying that when you get that test, if you get your hands on that test, the manufacturer somehow has to have a document on it that will, to some extent, indicate the reliability of the test. But it was all so vague, it was hard to tell what she was saying.
Yes, Lawrence, we need independent validation of these tests. And even from a single manufacturer's performance results, you want to compare different kinds of tests at the same time against standards, because we're going to be using these different tests in different parts of the country, And we're going to need to know, is the result in place 1 using test A meaningful and similar to the result in place B using test B? So we need to validate these tests. It's a little bit like Ronald Reagan used to say about the Russians: trust but verify.
Ron Klain, you know, when you were working on a possible outbreak, that one of the things that was necessary was to figure out what the benchmarks the public would need in order for the public to feel safe. And so when you sit here tonight, if you were working in the White House now, and the question of, you know, what do we have to do to enable universities to invite their students back to living together in dormitories in late August, what are the kinds of things that you would think the public would need to see and have available as information before deciding to let their children go back to those dormitories, or the universities welcoming them back, given that so much of the faculty is old enough to be in the high-risk group?
Well, I think there are 3 really important preconditions, Lawrence. The first is the amount of disease has to go down. The incidence of the disease has to go down. I think one vexing thing about what we're seeing in Georgia is, no matter what you think about the White House standards, and I've been a critic of them, the problem with what's happening in Georgia is they don't even meet the White House standards for reopening. 14 days in a row of decline of disease. I think that's a low bar to reopen, but that hasn't even been met in Georgia. We need to see much less disease before you reopen places. Secondly, you need to have testing, the kinds of testings Dr. Feinberg was talking about, all varieties of tests. We have to know that these serology tests not only work, but that it's a meaningful result in terms of whether or not someone has immunity. And then finally, we have to have the healthcare system in these places strong. That nurse on Long Island who you talk to, we have to know that hospitals can deal with flare-ups of cases when they come.
Dr. Feinberg, quickly before we go, let me just put this in personal terms for you. If you were a parent of a student who's considering going back to college, going back to the college dorm in August, or going back to high school in August, what would you need to know about what that student would be facing at that school?
I'd want to know that the school my child or grandchild was going to had taken all the steps that they could to protect the health of that child. It means keeping physical distance where you can. It means using masks. It may mean testing temperatures. It may mean screening on regular repeated intervals to make sure students who are coming down with illness are able to be isolated and separated from others. Basically, all of us in any industry, including schools, need to take these kind of steps to protect our students, our employees, our customers, our visitors.
Dr. Harvey Feinberg, a real honor to have you join us tonight. We really appreciate it. Ron Klain, thank you very much for joining us again with your expertise. We really appreciate it.